Hi everyone, welcome to my theory presentation. This presentation will focus on the health promotions model by Nola J. Pender and the social learning theory by Albert Bandura. Nola J. Pender. Ms. Pender was born August 16, 1941 in Lansing, Michigan. She completed her bachelorette in nursing in 1964 and then her master's degree in human growth and development at Michigan State University in 1965. She completed her PhD in psychology and education at Northwestern University in 1969, and then she published a conceptual model for preventative health behavior to study how individuals make decisions about their own health care in the nursing context. The first edition of Health Promotions in Nursing Practice was established in 1982, and then she served as an Associate Dean of Research at the University of Michigan School of Nursing from 1990 to 2001. In addition, Ms. Pender has conducted multiple studies, of which include the Health Promoting Lifestyle Profile, which is an instrument used to study the health promoting behavior of working adults, older adults, patients undergoing cardiac rehab, and ambulatory patients with cancer. As a nationally and internationally known leader, Pender speaks at conferences and seminars, and currently she collaborates with the editor of the American Journal of Health Promotion, advocating for legislation to fund health promotion research. The Health Promotion Model by Nola J. Pender. So this model focuses on three areas. The first is individual characteristics and experiences. The second is behavior-specific cognitions and affect. And the third is behavioral outcomes. So the Health Promotion Model, or HPM, describes the multidimensional nature of persons as they interact within their environment to pursue health. Health-promoting behaviors should result in improved health, enhanced functional ability, and better quality of life at all stages of development. So health promotion allows the focus to shift away from illness and then move towards wellness. A historical development of this theory is that it is a middle-range theory. It first appeared in literature in 1982 and then was revised in 1996 based on changing theoretical perspectives and empirical findings. It's constructed from two theories. The first is Bandura's social learning theory, and then the second theory is Feather's expectancy value theory. I will provide more details later about his theory, but Bandura's social learning theory focuses on self-efficacy, which means the greater the person's self-efficacy for a behavior, the more likely the person will engage in it, even when faced with obstacles. Feather's expectancy value theory means people are more likely to work towards goals that are of value to them and are more likely to invest their effort in goals that they believe are achievable and will result in the desired outcome. Some major assumptions of this theory is that it reflects the behavioral science perspective and emphasizes the active role of the patient in managing health behaviors by modifying the environmental context. In her book, Health Promotion in Nursing Practice, Pender stated the major assumptions of the health promotion model by addressing the person, environment, and health as follows. The first one is persons seek to create conditions of living through which they can express their unique human health potential. Number two is persons have the capacity for reflective self-awareness, including assessment of their own competencies. Number three is persons value growth and directions viewed as positive, an attempt to achieve a personally acceptable balance between change and stability. And number four is individuals seek to actively regulate their own behavior. Number five, individuals in all their biopsychosocial complexity interact with the environment, progressively transforming the environment and being transformed over time. And number six is health professionals constitute a part of the interpersonal environment, which exerts influence on persons throughout their lifespans. And lastly, number seven is self-initiated reconfiguration of person-environment interactive patterns is essential to behavioral change. Some major concepts and definitions. prior related behavior, which can be same or similar behaviors in the past, personal factors including biological, psychological, and sociocultural, biological being age, gender, BMI, strength, menopausal status, psychological being self-esteem, self-motivation, personal competence, and perceived health status, sociocultural being race, ethnicity, education, and socioeconomic status. Perceived barriers to action. It can be anticipated, imagined, or real blocks that make it hard for someone to act a certain way. And perceived benefits to action are anticipated positive outcomes that result from health behavior. Some major concepts continued. Perceived self-efficacy, which we discussed earlier. This is defined as judgment of personal capability to organize and execute a health-promoting behavior. Perceived self-efficacy influences perceived barriers to action. So basically, higher efficacy results in lowered perceptions of barriers to the performance of the behavior. Activity-related event describes subjective positive or negative feelings that occur before, during, and following behavior, based on the stimulus of the behavior itself. Activity-related affect influences perceived self-efficacy, which means the more positive the subjective feeling, the greater is the feeling of efficacy. So in turn, increased feelings of efficacy can generate further affect. Interpersonal influences are cognitions concerning beliefs, behavior, or attitudes of others. So this can include norms, social support, and role modeling. Primary sources include families, peers, and healthcare providers. Situational influences are personal perceptions and cognitions of any given situation or context that can facilitate or impede behavior. So commitment to a plan of action. Intention and identification of a planned strategy that leads to implementation of health behavior. Immediate competing demands are things which are low in control, and they include things such as work or family emergencies. Competing preferences are things that individuals have high control over, such as choice of ice cream or an apple for a snack. And lastly, health-promoting behavior is an endpoint or outcome that is directed towards attaining positive health outcomes, such as optimal well-being, personal fulfillment, and a productive living. Examples include eating a healthy diet, exercising regularly, managing stress, and then getting adequate rest. Some implications in nursing are: this model describes the interaction between the nurse and the consumer while considering the role of environment in health promotion. Health promotion was viewed as optional, and encouragement of healthy behaviors was not always included in routine care. Health promotion is beneficial to maintaining health and preventing some of the most common illnesses Americans face, such as heart disease, diabetes, chronic kidney disease, and much more. Rehospitalizations cost Medicare billions of taxpayer dollars a year. So, in turn, proper education and patient advocacy can help prevent these problems. Health promotion for healthy people can help prevent the development of unhealthy habits that otherwise lead to the common illnesses that I just mentioned, but it also has its uses in the population recovering from illness. In the distant past, many acutely ill persons were encouraged and expected to assume a passive sick role. Hospital stays were longer than today's, and expectations for self-care after discharge were relatively simple. Today, an increasing number of people are surviving acute illnesses, and a greater number of people live with chronic illnesses, which are subject to acute exacerbations. People are being treated and rapidly discharged from hospitals. Therefore, expectations for at-home management of complex conditions and treatment regimens have become common. People and their families are taught how to manage chronic conditions, but not all people successfully manage to care for the chronically ill. This is one reason why health promotion is important, not only to maintain a level of wellness, but to prevent exacerbations or rehospitalizations in the chronically ill through education and empowerment. So, in addition to the obvious health benefits, health promotion can be used to cut healthcare costs. According to the Centers for Medicare and Medicaid Services, in 2011, there were approximately 3.3 million readmissions in the United States. And these readmissions contributed about $41.3 billion in total hospital costs. Some home health implications, which is the area where I practice in. In an effort to cut costs, CMS instituted the Hospital Readmission Reduction Program, which penalizes healthcare institutions if they have higher than expected rehospitalization rates. So not only does CMS look at rehospitalization rates, but also potentially avoidable events, which are a subset of outcome measures used in the home health quality reporting requirements. The health promotions theory is applicable to the specific patient population because it forces a patient to reevaluate their health concerns and by providing a structure for which to do so. So some examples of potentially avoidable events include pressure ulcers, hypo or hyperglycemia, UTIs, and falls. An example of this would be a patient that's managing their glucose levels might ask, what attempts in the past have I made to manage my glucose levels to keep it in the normal range? And that would be an example of prior related behavior. Then they would ask, how did I benefit when my blood sugars were controlled? And how did that make me feel physically? That would be an example of a perceived benefit of action. What barriers might keep me from learning how to manage my glucose level? That would be a perceived barrier to action. And who will encourage me to keep my blood sugar controlled? And that would be an example of social support. Do any of my diabetic family members succeed in keeping their blood sugar controlled? That would be an example of role modeling. And am I ready to set a goal and develop a plan to control my blood sugars? And that would be a commitment to a plan of action, which is where we want our patients to be. So when the nurse or provider considers all these factors, they are ready to educate and empower a patient to recover from illness or maintain wellness. So Albert Bandura, he is known as the father of cognitive theory, and his theory that I will be explaining is called the social cognitive theory. He was born December 4 in 1925 in Alberta, Canada. He graduated in 1949 from the University of British Columbia with a degree in psychology. He received his PhD in clinical psychology in 1952 from the University of Iowa. He became the president of the American Psychological Association in 1974. Some more about him is that in 1986, Bandura wrote The Social Foundations of Thought and Action, which provided a framework of his social cognitive theory. In 1977, he developed the cognitive theory, and then he published the social learning theory, which is another name for the cognitive theory, in that same year. In 1953, he accepted a teaching position at Stanford, where he actually continues to teach today. The origins of the social cognitive theory, Bandura, he combined cognitive and behavioral learning theories to develop the social learning theory in the 1960s. Over the years, Bandura's theory evolved to the social cognitive theory of learning. His reasoning stemmed from his observations of humans' internal codes of behavior. Based on Bandura's observations, he divided behavior into two separate events, learning and performance. Learning represented internal symbolic forms of verbal and visual codes that could serve as guidelines for future behavior. Some major assumptions of this theory is that people can learn by observing others' behavior and the consequences that result. Learning can occur without a change in behavior. Cognition plays important roles in learning. People can have considerable control over their actions and environments, and self-regulation plays a major role in learning, such as setting goals, self-observation, self-judgment, and self-reaction. So we move from the individual, such as behavioral and internal processes paradigm, to learning as a shared function among person, such as internal, behavior, which is external, and environment. The nature of humans is social. Therefore, we learn through social interactions, such as conversations and observations, apprentice activities, collaboration, cooperation, and teaching. Humans are intrinsically active and exploratory in attempting to impose order, stability, and meaning on experience. So the 4 principles of the social learning theory: attention. We cannot learn if we are not focused on the task. If we see something as being novel or different in some way, we are more likely to make it the focus of our attention. Social contexts help to reinforce these perceptions. Retention. We learn by internalizing information in our memories. We can later recall that information when we are required to do so. Reproduction. We reproduce previously learned information, such as behavior, skills, and knowledge, when required. However, practice through mental and physical rehearsal often improves our responses. Motivation. We need to be motivated to do anything. Often that motivation originates from our observation of someone else being rewarded or punished for something they have done or said. This usually motivates us later to do or avoid doing that same thing. So some implications in nursing. Bandura's theory is most often applied to patient education, and it focuses on how the person, the behavior, and the environment may have an effect on one's ability to learn. Although Bandura does not explicitly discuss the concepts that comprise the nursing meta paradigm, some are suggested in his theory. The social learning theory brings awareness to how a person's environment can shape their behavior and make it more or less rewarding to behave in certain ways. So an example of this would be the nursing meta paradigm, which is health, nursing, environment, and person. Health can be defined as a successful adaptation to life's stressors, achievement of one's full life potential, and unity of mind, body, and soul. A person can be defined as a holistic being in the world, an open system, an adaptive system, a being who is greater than the sum of his parts and is composed of physical, intellectual, biochemical, and psychosocial needs. And then the environment can be defined as external elements that affect the person, internal and external factors that influence the person, significant others that influence a person, and an open system that permits the exchange of matter, energy, and information with other people. And then lastly is nursing, which nursing is defined as a science, an art, and a practice and a discipline that involves caring. The goals of nursing are to care for the well and the sick and to assist with self-care activities. We help individuals attain their human potential. Using nature's laws of health. So the purpose is to place the client in the best condition to restore health and promoting adaptation of the client. An example of this would be the way the media casts like a negative picture on smoking. There are numerous ads, commercials, and even the literature states that smoking has a direct link to cancer. So smokers, when they hear and they see this, they are more prone to quit smoking, and they're more aware of the harmful effects of smoking. Some healthcare implications of this theory is the 4 principles of the social learning theory can also be used to train and develop skills in nursing staff and even in healthcare administration. Bandura observed that individuals do not need to have direct experiences to learn, and that considerable learning occurs by taking note of other people's behavior and the consequences of their behavior. And this is referred to as role modeling. So, research indicates that managers who are aware of their roles and responsibilities in promoting a positive work environment enhance learning, competence, and satisfaction. Dissatisfaction, of course, has a detrimental effect and is a significant cause of staff turnover. Health promotion and social learning theory recap. So, changes in the conception of human health and illness from the disease model to the health model. In order to be effective at health promotion, a holistic viewpoint must be considered. Many factors influence a patient's health decisions, whether it is sociocultural, physical, interpersonal, or relational. The patient must determine how to overcome these barriers. And as nurses and healthcare providers, we are there to guide them and to assist them into making better decisions for their health. The social learning theory can be used to reward behavior that is beneficial to a patient's health and then punish behavior detrimental to a patient's health. And these are my references. Thank you so much for listening to my presentation.